Hey there. I want to talk to you about this whole idea and concept in America called employee based coverage. It's a farce. If you're laid off or fired in any Western industrialized democracy in the Western world, you will not lose your medical coverage. That is fact. Here in the USA, healthcare is imperative for almost every American employee. And even then, some employees are still paying really high premiums. Also, remember, even if you're covered, and you supposedly have great coverage, insurance companies will do as much as they can to deny you the coverage you need when you need it. See what's wrong with that picture, folks? We need either a single payer system like Medicare for all or a UK style national health service. Republicans and even corporate Democrats don't realize this that either a Medicare for all system like Canada or a UK style national health service would be a disguised corporate tax cut. This is what would happen under either Medicare for all or a national health service. It makes expensive to open up a factory there than it would be in the United States. But because France has a single payer system and cover 100% of their population, it is cheaper labor costs, even though the wages are higher, it's cheaper to open up a factory in France than it is in the United States. See where I'm going with this? It will be a form of welfare reform because Medicaid would not be tied in whether you work or not. You can continue to work and get health coverage. So you'll obviously see less people on welfare and see less food stamps. It's overall less bureaucratic. Even if you can afford health insurance in the United States and money is no object, you still got to fill out all kinds of complicated forms because we have 1,500 or more insurance companies doing things 1,500 different ways. You talk about waste. There's nothing more wasteful than paper shufflers and private health insurance. It will eliminate the bankruptcy of working families and working individuals. It's also a national security issue. Think about it. The drugs coming in from China are not safe. They're substandard and not safe, and it's harming America. Same thing with a lot of the cheaply made products that come into this country. And it's a national security issue to not allow Chinese pharmacy, pharmaceutical drugs to come into this country. Instead, maybe what we should do is freaking nationalize the pharmaceutical firms here in the name of national security to keep our pharmaceutical drugs manufactured and American made. An ironic aspect about this is that China is a communist police state and Canada is a capitalist democracy. But our politicians will make it unlawful and make it a criminal offense to buy cheaper drugs in Canada, but that especially cheap drugs in Canada that come from the United States. But you can't go, you can't do that. But oh, let the Chinese drugs, pharmaceutical drugs, and medication come on into this country, folks. That's stupid. We need to be proactive with healthcare, single payer in whatever form, Medicare for all or a national health service. Feel free to subscribe, good, bad, and different, and comment. Have a great day.